Hello, I'm Matthew Gavidia. Today on MGH Life Sciences Medical World News, the American Journal of Managed Care is pleased to welcome Regina Ihrke, Senior Director and Wellbeing Leader of Willis Towers Watson in North America. Can you just introduce yourself and tell us a little bit about your work?
Thank you. Yes, I lead all of our kind of intellectual capital across Willis Towers Watson in the well-being space. So when we say things like that, there is obviously, wellness kind of started in the kind of healthcare space about solving for physical well-being. And as the years, 10 to 15 years have kind of evolved, we pulled areas together to make it more about solving for the person and their issue, which crosses things like financial well-being. So it has experts from our retirement practice involved. It has a key piece of employee insights, like what do employees really want and hearing that voice from them, and then how do they engage with programs. So it has our employee experience team and also kind of how we communicate to those programs from an employer perspective. So it has healthcare, retirement kind of perspectives, insights and communications perspectives. And then, we'll talk through this of what's evolving in the well-being space, things like inclusion and diversity lens, right? And then obviously the pandemic world has kind of created more of a holistic view of like how we solve. So I'm there connecting all of these smart people that I work with across Willis Towers Watson to bring the best thought process to solve for well-being for employees across the country and across North America.
Employee mental health has become a prominent factor amid the pandemic, with rising rates of conditions such as anxiety and depression being indicated by a great number of studies. How can safety measures help alleviate the worry that may come with returning to the workplace, especially as COVID-19 continues to surge nationwide?
So we have been doing a number of surveys, I would say, on a weekly basis since the pandemic hit. The most recent one that we're talking about today is called the Reopening the Workplace survey that was done for just across the United States, and we're kind of working on it through the globe now of how we adapt to those questionnaires. And that survey was about the health, safety, and well-being of what employers' tactics are and what they're planning. And I would say the number one priority from all of that from HR is really around communication. Like that's, if I think about when they had to rank what the priorities were, the highest priority at 69% was about communication. That from what are the plans, leadership commitment to the health, safety, and well-being of their employees and their families, and really trying to be transparent on what are all of the tactics that are being done from areas like, how do we create a different work-life experience in the workplace, from hygiene, PPE, screening and testing as you enter the workplace or before you enter the workplace, and also including very well communicated and thought through policies and procedures on if you have symptoms, if you have COVID-19, if you and if you have anxiety concerns, going to your question on mental health and anxiety, or if you're vulnerable to be able to get some of those activities, like if you're at a higher age bracket or a different, specific race, that there is communication and policies and procedures to protect those employees so that they can work from home as long as they can. And then also kind of communicating the pieces of those that have to go into the workplace every day. So that's a key piece. And then I would say the screening piece, which has been the most prominent in kind of the safety metrics, is 90% of employers are doing some type of screening, whether it be symptom checking, like, how are you feeling today, to somebody checking temperatures at the work site. And then we're starting to see what the testing strategies look like. Now, I think if you and I were having this conversation in March, I would have said 90% of employers were going to do COVID-19 testing on site. Our surveys are showing probably less than 15% will be doing COVID-19 testing on site. Partly there's just a lot of complications with it, from the expense that it is to cover it to things like just the process of how it's going to be done, and does that solve for anything different than just symptom checking and temperature checking that's out there from the false positives that are going on. So The key piece again is lots of different metrics and tactics are being done by organizations, and it's about packaging them and communicating them effectively to your entire employee base so that you understand kind of what those metrics are, tactics are, and then if there's a voice that you could have if you are concerned about actually re-entering the workplace at some point in time.
Just to build off of that, can you just discuss how the study was conducted and what measures were implemented?
Yep. So this survey was launched in June, middle of June, and we just released the results last Monday. I think that was June 22nd. We had over 550 employers respond to the survey, and it represents about 5.3 million employees. We have a really even distribution of industries. Manufacturing was definitely the highest at 26% representation, and everyone else was in this like 15 percentile service, like industries like general service, healthcare, IT, financial services, energy and utilities, and some retail. Retail was probably a little bit smaller than we expected it to. The survey covered many different areas. It started with some questions on just basic strategy. What is your plans for if reopening? How many people are in your work sites today versus how many do you plan to have there by the end of first quarter 2021? We had to pick a date, right? Not knowing what's happening and surges that are happening right now. That was a date we felt like we were comfortable with. From how many will be working on site to how many are going to be working from home. What are flex schedules that organizations are thinking through, in addition to furloughs, unfortunately, and layoffs, and other significant impacts like pay changes and kind of changes to benefit plans. Then there was a whole section on kind of leadership. What is leadership messaging been? How have they really empowered employees to be a bigger voice than they have before? From many things, from how do we're all changing how we work from the new normal. So how do they drive that, how we change, because we're all kind of learning and trying to figure this out together, and doing that crowdsourcing. And also, as we've had more things now arise, like in racial disparities and the social injustice that's happening, about the race voice that's happening as well. Then, of course, we had tactics in the safety metrics like PPE, social distancing, kind of travel, like when will that kind of let up? And then a whole host of items on strategic tactics in the well-being space, including kind of strategy, digital and virtual care areas, leave policies, and then kind of listening and communication. So it was a pretty long survey. We have about 75 pages of great data, and we're tracking that data as we will continue to do surveys like this the rest of the year. There are some comparisons that we did from what we asked in April compared to what we did in June, right? And where people's thoughts and processes were, and we'll continue to kind of measure that throughout the year.
Notably, in the survey, 71% stated that they have developed workplace safety and employee safety policies. Beyond what is being implemented in the workplace, how do these policies cater to employees?
So let's start maybe with remote worker, which seems to be the one that's on the news the most, right? So in 2019, 11% of the workforce working from home. I think right now, for those that can work from home, we're at like 70% are working from home. We expect by the end of first quarter that we'll have about 35% of the workforce working from home. So that to me says we're going to make a major shift back to the workplace. But there is a trend happening right now of strategies of working from home that haven't been addressed before. And let's start with things like, what is the as basic as tactics of what is the working from home stipend? We all kind of shut down and really now need to assess if you have a significant population work from home and we're not giving the appropriate stipend for things like better Wi-Fi, monitors, ergonomic chairs is a big one, and desks for people. Those are some pieces that we're seeing as being a trending area of how to bump that up to help and support the right types of employees out there. In addition, there's pieces like caregiving. So caregiving was kind of starting to trend in 2019 as something of a consideration. And it was out there really to kind of address the major focus of women in the workplace and continuing to try to support women leaders. And now what we're seeing is obviously the caregiving world is a much different world. We are all working from home, and we have lots of different ages of children. So from an e-learning perspective, all the way down to babies at home as people are trying to balance that with work. And what does that caregiving support look like? From not just emergency leave for caregive. That was kind of where most organizations focus, but things like, what do we, are you going to be able to give a stipend to help you kind of pay for some services that you didn't have to before, from nannies, from on-site daycare, from tutors as well. That's another key thing as we're starting to look at for the fall and trying to understand where in what cities and around states that will have different markets of schools going back at different stages. Then you kind of have those that are like having to go into the workplace, right? And there's those key pieces of, there's a lot of those people that never shut down or never left. And looking at things like, what do we need to do about alternative ways of transportation for those that are taking public transportation that are out there? We saw that a lot first in the healthcare worker space from trying to provide them, Uber and Lyft support that's happening. And then really those that are kind of going in from a manufacturing perspective, how they're seeing their work be more flexible. When are the hours that they're working are going to be? How do they, be able to have that voice and be much more open to saying, I can't work at this time and this time because I got kids at home, and being able to listen to those needs that are out there. So that's kind of from that policy kind of adjustment workforce that we have. And then what we also kind of see trending right now is as there is concerns on loneliness and isolation, over productivity, nobody taking PTO and vacation time, right? Is what is this kind of ongoing stress and anxiety that's going to be happening in the workplace? And most organizations started with providing their EAP as a solution, but unfortunately, we've seen EAP utilization actually go down since the pandemic hit in March than it was pre-pandemic. And so there's much more of understanding what employees need at different levels. Do they want just articles on your website? Do they want some digital technology to help them through stress, things like you see advertised on TV that are more mainstream these days, to providing those breaks in time to do things like get outside, get some fresh air, stretch breaks, yoga. And then we're also starting to see forced vacation or holiday time outside of the norm. So we have a lot of organizations, especially taking the holiday weekend and saying, maybe Friday is your holiday for 4th of July, but now Monday is also going to be your forced holiday as well from a mental health day. We're starting to see more and more organizations start to put those in because I think PTO vacation is down 40% right now compared to where it would be normally.